right, so today's the big day. 10:30 this morning, headed over to Hale Vision Center in Brookfield. Dr. Hale's going to do my Lasik procedure. I am a little bit nervous, not going to lie. But Dr. Hale did explain everything down to the very last detail on Wednesday morning at my final exams.
So you're going to sit on the little edge of the chair. I'm going to come at you with a little sterilized skin marker and actually put little dots on the white part of your eye so I get a vertical alignment guide. So I will put these little dots on you. They will lay you back on this little chair. I'm going to put a little pillow around your head and neck, a little deflatable thing. I'm going to cover up one eye. I'm going to slide you underneath the first laser. There's head positioning in each laser and it's different. So I got to get you lined up. Once we're lined up, we're going to put a little lid holder in.
Alright, this is where you feel the pressure and get all funny. Remember, you're going to lose vision during this. That's normal.
And it was a little scary at first as everything kind of went dark and caved in, but totally normal. All I had to do was lay back, relax, and let the doctor create that perforation around the colored part of my eye. The suction was on there because the laser can't cut around a curve, and your eyeball is obviously spherical in shape, so it created a suction for a flat point so the laser could create that perfect little perforation. And after he did the right eye, he moved over to the left eye and did the same thing. Afterwards, he swung me back into the middle so the nurse could kind of clean me up, put some antibacterial on, and prep my eyes to do the actual correction procedure under the other laser. So they swung me back over to my right and locked me into place underneath the Visix laser, and Dr. Hale used a little instrument to kind of dig underneath that perforation that he created with the other laser. Kind of rubbed underneath and pulled the flap back and left it open on its hinge. Now he's got to line the laser itself up with the marks he made when I first came into the procedure room. So he's going to lock my head into place. The laser's going to examine my eye, try to get a lock on the measurements it took the other day. And when it does that, you can hear the nurse shout out exactly how long the laser is going to be in action, correcting my vision. And we're away. There's a little pulsating sound. It's a little bit nerve-wracking at first, but I'm supposed to focus on the red flashing light right above me. Even though it is a little blurry, it's pretty easy to focus on. And in under a minute, it's all done. Dr. Hale puts some liquids on there, some antibacterial stuff to keep it hydrated, and puts the flap that he moved back into place, smooths it out so it's back and nice and smooth and there's no wrinkles. And we've got to wait about another minute for everything to settle down so the flap can be back in place, and just so you can check things out and make sure everything looks pretty good. At this point, Dr. Hale notices that there's a little bit of a bruising up at the top part of my eye, underneath my eyelid, so you can't see it just looking at it. But that was caused back at the first laser with that little suction. That's normal, and it should go away in the next, day or so, he says. He takes the clamps that are holding my eyelids out, and it's time to move over to the other eye. Same procedure from loosening that flap, locking my head into place, and letting the computer get a fix on my eye, and it's another 40 seconds or so as the laser works. This time I did smell a little bit of a burning type of smell, but it wasn't hot. Again, my eyes are totally numb from the drops they put in way back at the beginning. And after the laser's done, he puts the flap back into place, smooths it out so there's no wrinkles. We wait for another minute or so to make sure everything looks okay, and we are pretty much done. They swim me back into the middle, let me sit there for just a short period of time, and then I'm sitting up.
All right, until you can see, they're going to look a little watery right now, so don't worry about that. You did great. It's not too bad. Good. Go and rest.
And walking out of the room. And even though the procedure was done just a little bit ago, everything looks pretty normal. I don't really feel any pain because of the numbing drops. I'm a little drowsy because of the Valium from earlier, but I'm ready to go home and take a nice long nap.